Okay, hey, we are live and we're recording. So, I doing this video, clients of Blueprint Investments and Tax Planning, and sending it out to you because a friend of mine, Laurel Jolliff, who you'll see here on the video, I'm going to have a discussion with her about Medicare insurance planning. And what made me think to bring this up and talk with her about it was she just did a case for my in-laws, and she saved them more than $200 a month in changing how my in-laws were doing their Medicare insurance. So when I saw that case and that outcome, I thought, boy, our clients at Blueprint Investments and Tax Planning ought to be hearing this information. We ought to, as a firm, be doing our job in providing the information and educating you all about it and about what's available. So I contacted Laurel, and she's been a long time friend of mine, lives here in Valley Springs with me and my family, and well, not with us, right, Laurel, not at our house, but we're you might say town mates or neighbors. And so Laurel's been life and health insurance licensed for a long, long time. She does all things Medicare. So she's an expert in that field, and you can, in fact, I'm life and health licensed, as you well know, Laurel, but I don't know anything about what you're talking about. So we specialize in the things that we do. So I wanted to bring Laurel on. One last bit of housekeeping: I do want our clients to know I have to wear this headset, otherwise you'll hear a whirling sound in the background on my laptop. And I'm working from Lodi today, so I've gone over to my friend's office, who's an estate attorney in Lodi. So that's why my office looks a little different behind me. So other than that, Laurel, let's dig into it and say hi to our clients who, and anybody else who's on our blog, on our website, who might be watching this. Tell them a little bit about yourself too.
Fantastic. Thanks, Cory. I'm so glad that we have an opportunity to chat. I mean, we see each other, in the restaurants and in stores occasionally and kind of catch up that way, but it's really nice to be able to catch up with you. And I think most importantly, it was great to be able to take care of your in-laws. They had a specific situation, and we were able to work it out to their advantage, that they're definitely going to be reaping some benefits. They're going to stop some accruing penalties, and they're in a much better place. And more importantly, they can rest a little easier knowing that they're saving some money and they're taken care of. And so that's my job.
Right. Well, yeah, let's talk a little bit about what created such large savings for them. I just initially go to, they obviously were on the wrong plans. What were some of the mistakes that they made in their plan selection that caused them to be paying too much and you to come in and kind of save the day?
Great question. So when mom-in-law was first eligible for Medicare, they made a phone call, or maybe someone called them, and they thought that it was the only option. And so they took the plan that this person offered on the phone, and not realizing that they could have had the same plan for a couple $100 less a month. And then more importantly, because they were talking to someone from a particular company, when asking about the prescription plan, the Part D, the company representative said, well, yes, ours is what, $90 a month or whatever it was. And your in-law said, well, forget it, we don't need that. And they chose to not take that Part D plan. Well, unfortunately, the representative didn't tell them that they would be penalized for the rest of their life for not having a drug plan, because that was the one drug plan that they offered, because it was the only one that that company offered. But your in-laws didn't realize that there were 31 other plans that they could have chosen from, and they could have eliminated the penalty if they understood that. But because they spoke to one representative from one company, a very well-known company, by the way, because of that, they didn't realize what their options were. And so fortunately, I was able to get together with them. We reviewed her prescriptions. I'm not a pharmacist. I don't, say yes or no to any prescriptions, but they give me a list of prescriptions. Actually, they got the bottles out, which I helped, and then I went to Medicare.gov, and it told us what the best plan was for her, and then we took care of it. It's pretty simple, but they didn't realize how simple it was because they talked to one representative from a well-known company who didn't tell them the specifics.
So it was tantamount to just basically shopping one company, that's it, not understanding that, hey, you could go to a broker such as yourself, Laurel, and shop 31 different plans, for example,
Right.
companies and different
Correct.
offerings. Now, that said, I mean, we all understand that, hey, maybe we don't buy something from the very first store we go into, right? We go to another store and we shop, or we shop various websites and try to get the best deals. So that's essentially the first mistake that was made in not shopping further. Now, you mentioned something about it getting more expensive for not having a drug plan. So, tell us a little bit about the penalties that are incurred over time if somebody waits to get a Medicare Part D is the part that you're talking about, right? Drug plan.
Mhm. The Part D, yes. So the Part D late enrollment penalty, that's what it's called,
Okay.
begins accruing when you're first eligible for a Part D plan, but you don't have one.
And that's at
So
age 65?
that's at age 65.
Yeah.
But some people have an employer plan, they're still working, or even an employer retiree plan, and it comes with a drug plan. You don't need to get the Part D.
Okay.
Okay.
You've already got it.
You
Yeah.
already have it. It's credible. As long as it's credible by federal government standards, you're good to go.
Okay.
For the people who don't have that plan, they are penalized for every month they could have had it but didn't. So, for example, just the other day I chatted with someone who knew about something she saw on TV, and I asked her if she was aware of the penalty for not having a drug plan, and she said, "Well, I don't take drugs. I don't need prescriptions."
Okay.
And I said, "That's great. You can do what you want, but it's my job to make sure you understand the penalty." And so she was gonna, if she got a drug plan starting in January, she would have paid almost $12 more per month because she waited 3 years for not getting a drug plan when she was first eligible. That $12 she'll pay for the rest of her life
Mm-hmm. Mm-hmm.
each month.
Now, that said, okay, so the Medicare Part D plans, they have a certain price each year, and those prices can fluctuate based on the market, right? But hers
Correct.
is always going to be $12 more
Not
for the rest of her
necessarily.
life.
It's actually 1% of the national average of a drug plan.
Okay.
So if that
Oh,
national average changes,
hmm.
that price changes.
So what we talked about thus far earlier, essentially off camera, was that's currently 32 cents per month that you have not had a drug plan. So in this case, if it was 36 months for this client, it's coming in at about $12 per month for the right now. So after 1 year, if market rates on these plans have changed, that 32 cents might be a little bit different, right?
Correct.
And
Yes.
but she's still going to pay whatever that number is times 36 months more.
Correct.
Okay, got it.
Correct.
So it's a
You
little
got it.
bit of a floating target, but it's more money no matter what for the rest of your
Right.
life.
Right.
Okay.
Right. Yeah.
Okay, that's 1% of the national
Now,
average.
she chose to not get one, which is totally fine. That's her choice. But now, when we chat next year, that 36 months will be 48.
48 months. So every year she's waiting. So, she could be saying, well, all right, now, so here's the financial advisor or planner in me is what if you took that monthly savings and you saved it over here and you got away with not having to take drugs for several years? How much money could you have? And could you then afford the additional expense when you finally do have to have a drug plan? And that's a number that, of course, as a planner, we would run for our clients and say, hey, maybe that
Right.
makes sense to me. If it's somebody who's really never, ever going to have drug expenses, but the vast majority of people do, right? And
Right.
they're not cheap. So
Right.
probably you're going to probably get advice from me as a client that, hey, you ought to have a drug plan just for sake of now you are making your investment savings safer by virtue of you're not going to have to tap it to pay these
Right.
what could be outrageous drug bills. Okay.
Right.
Um,
Exactly right.
so let's talk a little bit about why you and I are talking right now, because people need to be aware of deadlines, and there's a December 7th deadline here on
Yes.
implementing a Medicare Part D. A drug plan is December 7th. I mean, I know we're 11th hour here, and one thing I want our clients to have a takeaway from, and we'll talk about, is that they need to be contacting you or someone like you on a proactive basis each year when they have a birthday to revisit these things. So talk a little bit about deadlines and how people ought to approach them and their
Sure.
birthdays, for example.
So if you want to have someone review your prescription plan, Medicare Advantage plan, December 7th is your deadline. And so I'm sure Cory will give you my phone number when he emails us out to you if you want me to take care of that for you.
Yeah.
All I do, I go to Medicare.gov, and you can do the same thing. I go to Medicare.gov, I put in your zip code, I put in your prescriptions, and I put in where you want to shop. And then it's going to tell me of the 27 plans for next year are available to you, and then you can choose. The only difference between using me and going directly to Medicare.gov is now if you use me, I can help you throughout the year if there's an issue or a problem. I cannot help you if you go directly yourself. Totally fine. The price is exactly the same. There's never a price for a charge for my services because the companies you choose pay me. So that's how I get paid. I also try to explain things because it's not simple. It's not a simple process, even though they'd like to think it is. So December 7th is your deadline for prescription plan or Medicare Advantage plan. If you have a supplement plan, like a Plan F or a Plan G, then you can call me a month before your birthday and we'll shop. So we have what's called, if you're in California, we have a California birthday rule. And so that means that you can change to an equal or lesser plan with no underwriting right around your birthday. So that's kind of a fun thing, especially if you're with Anthem Blue Cross and Anthem says, well, happy birthday, your new rate is, and it's $20 more a month than you were paying because you had a birthday, it might be time to shop. And so I can look at companies because I'm a broker and I can show you what Anthem will cost. I look at United Healthcare, Blue Shield, HealthNet, IAC, and all the other companies because they all pay me. So it doesn't matter to me which one you choose. What matters is what's the best one for you financially, which of course makes your financial planner happy.
Right. Well, it's very interesting. I'm glad you pointed out, Laurel, that literally the price does not change for clients. It's a matter of, do you want professional guidance and help so you don't make mistakes, which in the long run is going to save you money or get you better coverage and better service and product, or do you want to go it alone and it doesn't cost you anything to work with you? I wasn't aware of that, Laurel. I didn't know that there was no difference in price whether somebody works with you or not.
No difference in price.
Let's talk a little bit about the county situation you mentioned as you spoke there. People will see Medicare commercials on TV and they think, oh, well, I can go ahead and get what's just been advertised to me, except it doesn't work quite that way, right? So talk about how people can actually have different plans available to them based on where they live.
Every single day, I get phone calls that say, I want the plan I just saw on TV. I want the plan that Joe Namath just talked about. I want the plan with free dental and free hearing and free vision. And my answer is always, what county do you live in? Because the county you live in determines what Medicare Advantage plans are available to you.
Okay.
Only. If I know you're in Calaveras County, not an option. If I know you're in Tuolumne County, not an option. Not all Medicare Advantage plans have the hearing and vision benefits, for example, but it was enough to get you to question and to make a phone call. I had someone call me the other day and said, I have 3 different phone numbers from 3 different commercials. I want you to call them and tell me. And I said, we don't need to do that. I know where you live. None of them are available to you. And so they're spending millions of dollars on marketing to get you to pick up your phone and to question what plan you have. If you have someone like me that you trust, or anybody else that you trust, like Cory, then you don't need to question whether or not you have the best plan for you. That's real. Yeah, you need to have an expert. A lot of people are blown away at how much I know. I don't know that much, but the truth of the matter is I am an expert at this. Right. And so when they question, how do you know so much? I just say, you don't need to know it all. You just need to know who to call. Who does? I don't know much about the financial planning world at all. That's Cory's business. But I do know Medicare, and I know what your options are, and I know the law. Frankly, the law is a big deal because it changes, and you need to have someone that you trust that does know the law and then keeps up on it.
Right. Well, and it's extremely important that we know what we don't know, and that way we know when we need to go get experts on that subject. So if we're, in my case, I do not know anything about Medicare supplemental plans or Medicare Advantage plans or but I know enough to know my clients need to know about it so I can quarterback getting them to an expert like you, Laurel. Let's talk a little bit about the Medicare Advantage plan, that being different than a Medicare supplemental plan. What's the difference between the two? I mean, is one private sector and one's public? Teach us about that.
The biggest difference is the Medicare Advantage plans. Most of them are HMOs or PPOs. There are some exceptions to that, but that means that you have to go to your network of doctors only. If you go outside of the network, you're paying 100% of that cost.
Okay.
The supplement, the Medicare Plan G, Plan F, those kinds of supplements, also called Medigap plans, those you can go to any doctor you want. As long as the doctor takes Medicare, they take you.
Okay.
So that's it. That's the biggest difference between them. The supplements, you pay monthly whether you go to the doctor or not. The Medicare Advantage plans, some are zero priced per month, some are $91 a month. It just depends, but they're all contingent upon which network of doctors they use. And then you have copays most of the time when you go to the doctor. They also have what's called a maximum out of pocket. And so, for example, if you were in San Joaquin County, and I think they've got like 23 different plans to choose from, they have a maximum out of pocket. So you might be paying $9 a month or zero per month or $79 a month, but you have a maximum out of pocket of say $6,700. That's where your financial bleeding stops. If you were to go into the hospital several times and have the expensive MRIs and CAT scans and all assisted living and all of that. And so if you use the services a lot, the max out of pocket comes into play. So $6,700, for example, for one versus someone who's paying $150 a month, let's say, if they're a 65-year-old, that's also a guaranteed price, but you pay it whether you go or not, whereas the Medicare Advantage plan, you pay it a monthly premium, but you also pay the copays only when you use them. Does that make sense?
Yeah, well, what brings up one question, will the max out of pocket differ based on, so do Medicare Advantage have higher max out of pockets compared to supplemental plans? Is that part of the trade-off in that Medicare Advantage could Medicare Advantage have a lower premium but more out of pocket, whereas the supplemental is a higher premium and lower out of pocket, or maximum out of pocket? Is that?
So that's a good way of saying it. The supplemental plan has no max out of pocket, but if you have a plan that's paying 100%, there's no out of pocket.
Right, there you go. Okay.
The Medicare Advantage plans, even though there's 23 different ones, let's say in San Joaquin County, some have a 5,400, some are 67, some are 3,200, some are 1,500. They're all across the board as far as their max out of pocket.
So one thing on the Medicare Advantage
So
plans
when I
is
have someone who's shopping Medicare Advantage plan,
yeah, go ahead, finish that thought.
when someone's shopping for a Medicare Advantage plan, I say, okay, there's three numbers that I want you to pay attention to: the monthly premium, the deductible, and that max out of pocket. Because again, that's where your financial bleeding stops if something happens, with your health that next year. So
Right.
go ahead with your.
Yeah, can they afford a hit like that, for example? So now, in addition to Medicare Advantage plans being dependent upon where you live, what county you're in, are they also dependent upon the income a person has or net worth? Are there qualifications that set those premiums? No? Okay. So it's just a matter of the amount of or type of coverage that you want as to what the cost is.
Correct.
Okay.
Correct. And your thresholds for, am I paying a deductible? What are my copays? Some people want to go to the doctor and never have to worry about a copay.
Mm-hmm. Right.
Some people don't go to the doctor if they don't have money in the bank because they can't afford it. They can't afford the copay. When you have a supplement like the Plan F, let's say, They don't look at their bank account. They don't look at the calendar to see when the next check is coming in. They just go to the doctor because it doesn't cost them anything.
Right.
And
Right.
a lot of other people I've found, they sometimes are afraid to spend the kind of money on a supplement because no, my money is for my kids. I've been working my whole life. I want to give my kids this money. Well, I promise you, the kids want you taken care of medically. The kids don't want to deal with the copays, and they don't want to deal with all of that. Pay the higher price for the supplement, get 100% coverage if you can, and I promise you the kids are happier.
It doesn't sound, I mean, well, here, I guess to the really important point is they need to be getting a second opinion, doing a review, um, probably on an annual basis to look at what's changed in their life and what has changed in the marketplace. Would that be your typical recommendation, an annual review?
Yeah. So for
Okay.
example, this year is
And
a great example of this. Uh, One company had a plan, prescription plan, Part D, that was $23 a month this year in 2020. Next year, it's $100 a month. If that person, now the company is sending a documentation to explain that annual notice of change documentation out. But the challenge with that is no one reads it. Why don't? Because they're getting 25 other pieces of mail that are advertising. They don't know the difference between an advertisement and an annual notice of change because they all look official. And you get kind of numb to reading all that stuff. And so no one reads it. So that's one example. The other example is there's a new plan out there this next year that's $7.20 a month. If someone isn't taking prescriptions and they're paying $20, $30, $40 a month for their prescription plan, they don't need to. They can pay $7.20 a month and be covered and not, incur a penalty and, and save a few bucks a month. And so that's who this open enrollment is for. The other one is a supplement, yes, and they should call me or someone you trust the month before your birthday, because you're going to get a letter that says, happy birthday, your new rate is. And so that's when you know to call.
yeah, and you had mentioned to me a client case where they hadn't done any review on their plan over a period of years, and of course it was just incrementally kind of creeping up and bouncing up. I think, did they get to what, $90 a month or something? Am I remembering
Next
correctly?
year, your plan was going to $91 a month.
Yeah, and so it's kind of that proverbial frog in the boiling pot of water, just keeps heating up on them, and they're not paying attention as it goes up a little every year. And then they do this review with you, and how much did you save the client in that case
I saved them a couple $1,000s for next year.
over the
I mean,
period
think
of a
about
year?
it. One of the two of them was going to pay $91 a month for their plan plus copays at the pharmacy. He was eligible and was best suited for that $7.20 plan with zero copays. And
Wow.
so that was a kind of a no-brainer. The challenge is people say, oh, I'm fine. I'm fine. My drug plan's working fine. And so my answer is that's this year.
Hmm.
Let's compare it to next year. Let's look at next year's options because they changed. They all have changed. And so you just need to be aware of it. Most people don't want to take the hassle of checking it out. Whereas the hassle is really on me. And I'm honored to do it. And that's what I get paid for, by the companies, not by you. And so what I do is I say, okay, you email me your list of prescriptions or call me, email me preferred. And then I will go to town. I will go to Medicare.gov and I will put in your prescriptions and your zip code and the store you prefer to buy them at. I also need to know what plan you currently have. And then we compare. And if it makes sense financially, then we change. I do that for you. Or you don't. But now you know if the plan you have currently is the best one for you next year, you know that with confidence that when you go to the pharmacy and you're paying $23 for a copay, you know that there's still the best one for you for 21.
So
And
that
so
raises the
that's kind of just
question.
something that people should do every year.
Right. Well, on that subject now, every year there's open enrollment October through, is it October 1st it begins?
October 15th
15th through,
through December
now, right
7th.
now is it December 7th? Okay. Now, is that only on Medicare Advantage or is that also on their supplemental plans?
It's only Medicare Advantage and
Okay.
prescription drug only.
Okay. And then your supplemental plan is every year on your birthday.
Correct. Or
Okay.
before,
So,
preferably.
yeah.
Mhm.
Well, yeah, they ought to be reaching out to you a month before, because otherwise they're not going to get on your calendar, uh, in the month following the birthday, which is typically, you said the period is about a month, depends on the company, after your
About a
birthday.
month. Some companies are before, during, and after, some are within 30 days, some are 45
Okay.
days. That's my job to know all that.
Okay. Um, Boy, I think we've covered everything I wanted to cover with you on our notes, and yeah, yeah, I mean, yeah, we have. I mean, you mentioned hearing and vision benefits earlier. Now, so are there some plans that are less expensive because they don't include those benefits, or do all supplemental or Medicare Advantage plans include hearing and vision benefits?
So I'm glad you asked that because
Okay.
it was totally wrong,
Oh,
which is
okay.
great because that's what people think.
Okay. Yeah,
So
there you go.
supplement plan, none of them include dental and vision and hearing.
Okay,
None of them.
supplemental, none include that. Okay.
Correct. Now, if someone needs cataracts, if they have macular degeneration, or if they have another medically related vision issue, it's covered under the supplement because it's medical.
Hmm.
Cataracts are medical. They don't need a vision plan for that.
Okay.
Okay. When when folks are hearing the commercials, including dental and vision and hearing, those are the Medicare Advantage plans, and it's not all of them, it's some of them.
Okay.
And it's, remember, depending on which county you live in.
So
Okay.
let's take Tuolumne County, Calaveras. If you have a county that does not offer Medicare Advantage plans, then you don't have a Medicare hearing and vision option. Is that what you're saying?
That's
Okay.
exactly right.
Okay.
Right. Right.
What are the solutions for people in that? I mean, private health insurance, they would have to go out and get, is it even and I
Well,
imagine that could be expensive.
I'm licensed to sell them, but I don't. And here's
Hmm.
why. I think they're garbage.
Yeah.
Costco has a fantastic dental plan, only in California. It is a dental HMO. They really should pay me for this because I tell everybody. They don't. So Costco, it's $90 a person per year, no deductible, no waiting period, and no cap.
Is this only for people over the age of 65 on Medicare, or can anybody, any member of Costco get this?
All ages.
All
All
ages.
ages. Yeah.
Okay.
Uh-huh. They also don't have a time of year that you need to have it. It's an open enrollment, if you will, all year long. The biggest challenge is it's a dental HMO, and so you have to go to their dentists. I saved a few $1,000s because I had it a few years ago. It was worth it to me. I had to go to a specialist. I drove to Elk Grove for it 3 or 4 times, but it still saved me a few $1,000s. Some people don't want to drive, and that's totally fine. I think there's one dentist in Valley Springs that still takes it,
Hmm.
but they're few and far between. But it's the best bang for your buck for dental insurance.
Wow. Okay, that's very good to know. In fact, I'm going to look into it for my family. Um, hadn't
Yeah.
crossed my mind.
I
Well,
mean, dental insurance, they're like $75 a month for a family or even for 2 people.
mhm,
And there's a year waiting period for major work. And there's a $1,500 cap. So you do the math
right.
and figure it out. And so what I tell people is if you're married to your dentist, or I should say that nicely, if you have a dentist that you just love, that you cannot live without, just pay the dentist.
Mm.
Just pay them.
Yeah, rather than have dental
Don't waste
insurance.
your money on the
Yeah.
insurance. Yeah.
Yeah. In fact, I mean, that's the situation our family's in. My wife's never had a cavity in her life, and my kids got her teeth, so
Right.
we haven't had, it's me, I'm the problem. But you say Costco's $90 a year? I mean, to
A
be part of
year.
the, wow.
Yeah. Yeah.
Um, Laurel, I'm up against another meeting coming up, so let's just wrap up with any final thoughts. If there wasn't anything that we didn't get in that you thought, shoot, people really need to know,
Yeah.
let's go
No,
ahead and hit it.
yeah. So one is if you think it's a hassle, it's not. remind yourself it's really not that much of a deal, that big of a deal. I do the work for you, or it's not just me. Find someone you trust that knows the law and understands Medicare, but do it annually. Your prescriptions change, the plans definitely change. Do it annually. It's so important. Don't let the frog boil. You know, that's actually my biggest.
Well, and that's the birthday reminder. You know, I mean, people think, well, I won't remember to do it. Well, do it
Exactly
every
when you
birthday,
get
right?
that letter.
Yeah.
Yeah.
Okay.
And this is the other thing is read your mail. And
Right.
every year before October 1st, the companies, every prescription plan had to, by law, notify you of the annual notice of change.
Okay.
I bet 10% of my folks, and I have hundreds, read it.
Wow.
But
Okay.
90% didn't read it because, again, they're dumb because they're not. They're bombarded by junk mail by the same company. And so they don't know what's real and what's junk. And so it's unfortunate. And I tell everybody that I can think of, you got it by law. You had to have gotten it before October 1st.
Mm-hmm.
And most of them said, yeah, didn't get it. Or, oh yeah, it's in a pile of stuff.
Right.
And it's just really important that you have someone that you trust to help you through this. It's, you know, I'm not an expert in most things, but I am an expert in this.
Right. Well, on that subject, folks, I can vouch for Laurel. I've known her a long time. I know she does right by her clients, and she sure did right by my in-laws, my family. So thank you, Laurel, for that. You saved them. Wow. I mean, a few $1,000s a year at more than $200 a month. So that's fantastic. Maybe as a result, I'll get more for Christmas from them. You know, since they got that extra coin in their pocket. All right, well, thank you. And what we're going to do is we're going to post this video on our blog, and we'll get it emailed out to everybody, and we'll have your contact information as part of that email in the blog post. And shoot, hopefully, if people can't use you before December 7th, they're at least using you around their birthday, and then again next year, come
Perfect.
October, November.
Perfect. God
All
bless
right,
you guys.
thank you so much, Laurel. Bye bye.